Hello, hi everyone. This is Dr. Erica Onikbola, and I am coming to you briefly. I just want to say Happy New Year's to everyone, and thank you for joining my channel. This topic today is going to be about irritable bowel syndrome, IBS. Two components of IBS is going to be constipation and diarrhea. Now, they both have symptoms such as stomach cramping, abdominal dysfunctioning, occasional constipation or occasional diarrhea that cannot be very well controlled normally. And so that's when patients tend to seek out medical help through their physician. And so irritable bowel syndrome can be treated with prescription medications and can be relieved, symptoms can be relieved with over-the-counter medications initially. So irritable bowel syndrome is a disease type where there's two types, either constipation or diarrhea. And clinical presentation with diarrhea usually, again, can be acute diarrhea episodes within 72 hours of onset. Chronic diarrhea may involve frequent attacks over extended period of time. Nausea, vomiting, abdominal pain is like what mentioned earlier, headache, even fever, chills, and also bowel movements may be frequent and never bloody. Diarrhea may last 12 hours to 60 hours. Okay. And then also, there can be weight loss or anorexia, weakness. There can also be a pain in the intestinal area. And also, there could also be cramping as well. Now, physicians may take a stool sample to analyze the stool and the contents of the stool, and whether there may be bouts of bleeding, or there might be a discoloration in the bowels. They're going to look for those things. So expect an examination where you have to give a stool sample when being diagnosed as well. And there are also medications that may be over the counter that can cause diarrhea, like magnesium citrate, which is used to help with constipation, but it can cause excessive diarrhea as well. So be aware of that. Antacids as well, and then also antibiotic therapy. That's well known, and I did a video on probiotics, which will help replace good bacteria that is lost during diarrhea. So after taking an antibiotic, it is good to take a probiotic. So because it's known that antibiotic therapy can cause diarrhea. Antihypertensive medications, um, cardiovascular medications for like arrhythmias, and then there's NSAID medications as well, like your non-steroidal anti-inflammatory medications, like your naproxen, your aspirin, also medications such as the ibuprofen. Those are all considered NSAIDs and may cause diarrhea type symptoms as well. Colchicine for gout prevention, protein pump inhibitors, uh, antihistamine blockers as well can also cause diarrhea, because they also work in the gut to help prevent GERD and gastric um, inflammatory disease. So by them working in the gut, they can cause diarrhea type symptoms, just because that's where their mechanism of action is actually being worked. So do be aware of those over-the-counter medications. If you're taking protein pump inhibitors or antihistamines for acid indigestion, things like that, that may be a side effect as well. I also want to mention that patients should make sure they're staying hydrated, and they are taking in lots of fluids as well to help with loss of electrolytes, loss of nutrition. So do be aware that there are electrolyte solutions on the market, Pedialyte, electrolyte, like the Gatorade products, liquid IV that helps restore hydration and electrolytes and minerals that are very well necessary. Okay. And there are guidelines that are recommended for patients who are dealing with diarrhea and that are lasting for so many consecutive days. And they, like I mentioned before, um, they can, which can be caused by infection, can be caused by um, malabsorption, can be caused by drug use, and also irritable bowel disease as well. Okay, and we've gone over the actually gone over the symptoms, so that was great. And selected anti-diarrhea preparations can include medications for anti-mobility, and adsorbents and anti-secretory medications like your Pepto-Bismol, and also your probiotics, and also medications like loperamide, which is a prescription medication, but it does help with the diarrhea type symptoms when taken as prescribed. Initially 4 milligrams, then 2 milligrams after each loose stool, but not to exceed a certain amount in a day. So loperamide, which is a 2 milligram capsule, can be given initially with the first dose as 4 milligrams, and then 2 milligrams after that first diarrhea episode. Okay, and those prescriptions, they do come with pharmacy counseling, and also they do come with package inserts as well to help with those. I've talked with patients before, and just to get their feedback on what they thought about taking the medications. And most patients do tolerate loperamide and the bismuth subsasolate, which is the Pepto-Bismol, and then also probiotic therapy is good as well. So I haven't had anyone to actually give a response that it wasn't working for them. So those medications are very tolerable and very popular when dealing with this type of disease. Okay, and then the other part of the irritable bowel syndrome, besides diarrhea, is the constipation. Constipation is a sub of irritable bowel syndrome. You can have diarrhea form, or you can have the constipation form, where the stool is firm and dry, and maybe more firm than normal, may consist of blood particles, may consist of a dryness, less fluid. So with that being said, it's recommended that patients maintain a nutritional diet, may stay hydrated, and then report any symptoms that you may having, like the cramps, the abdominal pain, this discomfort, and bowel flow as well. Okay, and possible causes of constipation can be irritable bowel syndrome, upper GI tract disease. It can be hemorrhoids as well, tumors. It could be things like tuberculosis, patients who are dealing with infectious diseases, and patients who are dealing with heart failure, even low dietary fiber, low nutrition in the diet. Okay, and also patients who are dealing with Parkinson's disease as well, and also patients who have decreased physical activity. I am a big advocate of patients who exercise regularly. patients who go out and get that 150 minutes per week of exercise to make sure that they are doing their due diligence to get their blood flowing. That helps rid the body of waste, whether it be fecal waste, urinary waste, sweat, any kind of waste that the body needs to get rid of. Exercise helps get rid of that through blood flow, the increase in blood flow and heart rate. So do remember that. So patients who do not are not able to receive that 150 minutes of adequate exercise per week usually deal with constipation and dehydration as well, and also low kidney function, low organ functioning, because the blood, again, the blood flow is not there. So we want to make sure that we are doing our due diligence when exercising 150 minutes per week. Okay, and also dietary changes, inadequate fluid intake, low dietary fiber, trauma to the brain, patients who are immobile or have spinal cord injury. Okay. Also, postponing urge to defecate, psychiatric disorders, patients who are on certain medications that may hinder the body of actually using the restroom on a regular basis, prescriptions that are anticholinergic, prescriptions that are refrain the body from defecating, can also be aluminum products that contain aluminum, prescriptions that contain anti-diarrhea medications like the Imodium, which is over the counter. Those prescriptions, when taken not consistently or not taken correctly, can cause the opposite effect, which is going to be the constipation. So it is recommended that when taking those medications, do take as prescribed, okay? And ask your pharmacist also. Anticholinergic medications, Imodium, prescriptions that calls for dry antihistamines can also cause constipation, because they tend to absorb moisture. Moisture is used for defecating. It helps to properly bring fluid into the bowels and help to lubricate the bowels so that movement can occur. So we want to make sure that when taking antihistamines, Imodium, aluminum products, medications that just cause our GI tract to not flow very well. Be aware of those, okay? All right, and then also there are some possible causes that I've gone over. And when dealing with constipation, there are some laxatives that are available over the counter before seeing a doctor for a prescription medication, like the Senna, which is all natural. Senecot is all natural. It's a natural stimulant. Magnesium as well can help with constipation, dealing with that, and also bisacodyl oral, and then also magnesium as well, and then the polyethylene glycol, and then also docusate and lactulose as well. Okay, mineral oil is also good. Enema is also good. Enemas, they work within a certain time frame. They work very quickly and can help with constipation within a certain time frame. Okay, so with that being said, I just wanted to mention irritable bowel syndrome on today and some of the medications that may cause constipation or diarrhea, and some of the symptoms and what to look out for, and of irritable bowel syndrome within a certain time frame. It can be diagnosed, and also there are medications that can be rendered. Okay. All right, so I'm gonna Thank you for joining me. If there's any questions, please let me know. Also, just want to make mention the antidepressants shown some benefit in treating the diarrhea subtype of irritable bowel syndrome. Okay, and that was a little surprising to me. I guess it was surprising that I was able to remember that, and also serotonin reuptake, serotonin receptor antagonists and uh, agonists act on GI specific serotonin receptors to treat constipation, predominant and diarrhea predominant irritable bowel syndrome. So there are certain particular drugs in a class that can help treat irritable bowel syndrome constipation or irritable bowel syndrome diarrhea. Okay. And those are the allocetrone and the tegacetroid, which are serotonin receptor agonists and antagonists. Okay. So we've talked about those, and we've talked about loperamide. We've talked about um, over-the-counter medications that can be used, and also serotonin reuptake inhibitors, antagonists, and also natural laxatives such as the Senecot and the Senna. We've talked about saline, mineral oil, okay, lactulose, opioid receptor antagonists. As we know, opioids are medications that are indicated for moderate to severe pain, and because they are medications that act in the GI on mu receptors in the GI tract, they can have that constipation side effect, such as not being able to use the bathroom after large doses are given. And then also iron. Iron is a mineral that can be picked up over the counter, and because it works. It is a medication that causes constipation as well. Okay. And also, I wanted to make mention of lubiprostone. It's the first new drug in a class called chloride channel activators, and it acts locally in the gut to open chloride channels on the GI, stimulating chloride-rich fluids secretion into the intestinal lumen, increase intraluminal fluid secretion, helps to soften stool and accelerate GI transit time. So the brand name is going to be Amitiza, which is lubiprostone. It was approved in 2006, and has that known fact. 124 milligram capsule twice daily in food can help with constipation. Okay, so and that is for constipation, irritable bowel syndrome, and also there's glycerin products, suppositories that are over the counter that can be picked up as well without a prescription. And then I mentioned polyethylene glycol, which is the Miralax. It's also a medication to help treat constipation as well. Excuse me. Okay, and then the laxatives. I've gone over the laxatives, the Senna, the bisacodyl, magnesium. I've gone over the Miralax, and also docusate lactulose, sorbitol, mineral oil, polyethylene glycol, and then psyllium as well. Those are laxatives that can be picked up as well. And And so let me go over this. Some of the patients that may deal with constipation, those patients may have signs and symptoms of weight loss, nausea and vomiting, um, discoloration in the stool, anemia, family history of inflammatory bowel disease, new onset or worsening of constipation in elderly patients, and then severe persistent constipation. Okay, so patients who are dealing with constipation, the treatment algorithm may be stool frequency or stool consistency, difficulty of defecation, diagnosis, treat specific cause, no diagnosis, symptomatic therapy, bulk forming agents, dietary modification, exercise, alter lifestyle, increase fluid intake, and discontinue a potential drug inducer. Okay. No routine recommendations for lab testing as indicated. So there's no routine recommendations for lab testing. A patient with signs and symptoms suggestive of organic disorder, specific testing may be performed. In patients with alarm signs and symptoms or when structural disease is a possibility, select appropriate diagnosis studies. Okay, colonoscopy is one. Barium enema, protoscopy, and sigmoidoscopy as well. These are diagnostic studies. Okay, and then also drug causing constipation. I've gone over that. Opioids, anticholinergic like your antihistamines, Parkinson's disease medications like your benztropine, also antacids, and then the medications for mental state, diuretics as well, muscle blockers, polystyrene, sulfonate, and then calcium channel blockers as well, diuretics, antihistamines, phenothiazines, and those antidepressants, tricyclic antidepressants, um, can also cause constipation as well. And so, if you're on any of those medications, please let your pharmacist know so they can communicate with your physician to make sure that medications are adjusted properly. Okay, so thank you for joining me. I'm hoping that the information that I read to you was very informative and very appropriate for you learning and being knowledgeable about what can be treated, what can be prevented. Some things can be prevented just through exercise and nutrition. I just want you to be aware of that as well. And so, upon listening to this video, please leave in the descriptions or let me know what information you have or would like for me to do a video on. Thank you for joining me, and I'm going to sign off. I am Dr. Erica, a pharmacist, a PharmD, for over close to 10 years now. And I want to say a happy new year to everyone, 2023. I hope it brings prosperity and blessing and everything in between for you and your loved ones, and for your health and your QOL, your quality of life may be on point. Everything that you wish it to be in the future. And I do hope that everything is very well set out for you, for not for 2023, but beyond, and that the blessing and promises that are for us is given to us, and that we embrace every aspect of it, and that we do what we can do for ourselves, for our talents, for our neighbors and our loved ones as well. So I want to thank you for joining me, and I'm going to sign off, and I hope to see you on the next video. Goodbye.